I just want to welcome everyone today. My name is Kristen Johnson. I'm in the political science department, and I've been working with the center for a while now in an expanded role. We are really lucky for two things that I want to talk about today. One is that we have a fantastic colleague, Dr. Tupten Tandhar, who has organized this really outstanding inner peace and mindfulness initiative that is offering students and faculty and staff in the community an amazing resource during this challenging time, and has organized and put together this talk. And so we are really lucky to have him as part of the center team, offering his expertise and insight. So Tupten, you thought you were going to dodge that today, but you're not. And I'd like to briefly introduce our speaker. So Dr. Ashley Buchanan is a professor of biostatistics, which is such an interesting combination with but I can really see the alignment in the Department of Pharmacy Practice. And she is also has a very interesting research program with expertise in substantive mechanisms to improve methodologies and treatments for HIV/AIDS, and then also opioid use disorder is one of her more recent areas. But in addition to this really great expertise that utilizes a lot of quantitative studies of public health and big data, she is also part of the URI Mindfulness initiative and participant, and she is an instructor in Shambhala Path Meditation. And so what an interesting combination of two areas of expertise that are likely much more complementary than would be obvious. And so I think I'm going to hand it over to her, because that is why we are here, is to listen to her expertise today, but also to just ask folks, maybe put questions in the chat if you'd like, unless Dr. Buchanan has a preference for taking them as they come, and we can field them at the end, unless you do have a preference for, again, more of an interrupted structure. But thank you very much for joining us on this beautiful day, and I hope everyone has enjoyed the weather.
Thank you so much for that nice introduction. I think, with this small of a group, I definitely welcome questions and more of a dialogue. I did put together a few slides with some visuals and things, mostly just to keep me more on track. But my plan is, to share some ideas and thoughts, and then we can practice meditation together, one that I've been finding really rich these days, about contemplating the 4 limitless ones, and specifically the loving kindness practice. So I'll guide us through that. And then, we can spend the rest of the time just in conversation, anything that comes up, happy to chat. So great. Let me just share. I know everyone's probably sick of slides, but I think there's maybe some interesting tidbits in here. So essentially, we're going to talk a little bit about, what is meditation, and then defining it, and then looking from a health perspective of evidence about what this could be doing to our bodies, to our emotions, and how this can improve health, thinking about it both from a patient's perspective, as well as thinking about our medical providers and how this can help them deal with stress and challenges. So in meditation, how many people here practice meditation or have done it before? Just so I can, let me just get out of my, sorry, one second. Let me stop sharing so I can see everyone again. One more time, sorry. Okay, so about half. So yeah, so I'll go through this. Okay. So when we meditate, I think, in learning about this, I've been practicing myself for about 10 years. I've always been interested in it, but then really dug in about 10 years ago to have a daily or more regular practice. And we're actually not trying to stop thinking or even change our experience. So I think when I was beginning, I was like trying to get my thoughts to stop and become like some spacious zombie or something like that. But that's not really the point. It's actually to notice, just notice what's going on with us and what's going on in our minds. Because these days, I think maybe most of us would agree with this, we're very outwardly focused. In the past year, I've been very focused into a laptop or a specific computer. So like we're not spending as much time just sort of seeing what's going on with our inner experience. So it's a chance, and I think of it as self-care. So we're slowing down and we're just looking, and like a good friend, we're not judging or criticizing ourselves, but we're just sort of seeing and seeing what maybe needs tending or what needs care. And so in that sense, anytime we sit down to meditate, whether it be on a park bench or in a cushion or in a chair, it's a good meditation session. So there's no good or bad session. Every practice is good. And then awareness is closely related to that. And as we cultivate mindfulness, we notice our sense of awareness of, it could be the physical space we're in, it could be awareness of others and their needs, or awareness of situations. And as we cultivate mindfulness, we notice that we maybe become aware of things that maybe we didn't notice before. And to take a simple example, that might be, if we're really caught up in our to-do list and our worries, we maybe go for a walk and we don't notice that new daffodil that just popped up. But if we have slowed down a little bit, we actually can look out and see things happening in the world. So I really like this quote from Chogyam Trungpa Rinpoche, who's actually the founder of Shambhala, and he brought that tradition from Tibet to the West. So in this quote, he says, meditation is not an exclusive activity that involves forgetting this world and getting into something else. By meditating, we are dealing with the very mind that devised our eyeglasses and put the lenses in the rims. So that kind of sums up in a much more poetic way, maybe what I was trying to say a slide or two ago. So recently, there's been increased interest in, I guess as Westerners, we really just want to quantify everything. And even as a statistician, we want to see the data and see that it works. So there's been all sorts of groups, research teams that are looking into how does meditation work? What changes is that potentially associated with in the brain, in the white matter and other parts of the brain? How is this impacting our psychiatric and stress-related states? So there's, I just pulled a couple articles I found here, and it helps us regulate our attention, be more aware of our bodies. Other benefits are emotional regulation, as well as changes in the perception of self. So I'm sure there'll be more and more studies coming out looking at, how does meditation work and what are the effects? But in my own personal experience, I find this all very, very interesting as a scientist and a public health person. But for me, my experience with meditation has been, I just try it and see what happens to me and see if it makes a difference, and then try some more and that type of thing. So it's sort of like like just testing it out on my own. Meditation can also help with reducing anxiety and depression, as well as treatment of post-traumatic stress syndrome. And I think importantly, something that was, kind of stressed with me as I was learning meditation is that, meditation itself isn't some magic medicine that's going to take care of everything, right? So if we actually have a mental health disorder or extreme pain or something like that, we want to, it can be part of a multifaceted treatment, so that we're not only seeing a psychologist or a psychiatrist, but we're also practicing meditation, or we're seeing a pain doctor and practicing meditation. So I think, meditation is awesome and incredibly helpful, but at the same time, I appreciate personally having the option of modern medicine when facing different health challenges. And that's just a picture of the medicine Buddha on the side there, which I felt like that image really belonged on this slide. And if you're interested to learn more about the medicine Buddha, I found a little article at the bottom there. So in patient populations, we can use meditation in combination with other treatments. I found some examples of diabetes, hypertension, I actually even found some new articles about using it in combination with patients with COVID-19 disease. We can help to improve individuals' quality of life. So patients who have really serious cancers, as well as their caregivers, to help them manage stress and make the most of their days. And then also to improve palliative care as well. And then thinking from the patients, also thinking about how meditation can help and take care of the providers themselves who, often really overextend themselves, particularly during a pandemic. So thinking about how meditation and mindfulness can help them deal with burnout, address stress, anxiety, and depression, and then also create a more positive workplace through practicing meditation together and creating an environment where people can just slow down a little bit and take care of each other. And then ultimately, if these healthcare providers are have the opportunity to take better care of themselves, they can have more available to give to their patients. So we're all living through a pandemic, and I think having mindfulness as a tool, as a resource during a pandemic is incredibly useful. So I've even been, for students that I teach, we actually start class now with just a few minutes of mindfulness together, which is essentially just I guide them through a little bit of breathing. And I think having moments to pause like that and just be are really helpful, not only for our sort of healing from going through this process, but also our ability to regulate and be resilient. So unfortunately, during COVID, there's been pretty incredible documented increases of mental health and substance use disorders. One article found that after COVID, about 53% of the US residents in the sample reported at least a moderate to severe level of depression, compared to just 25% before COVID. And meditation has the potential, again, not to necessarily cure those patients, but can be used as a complementary treatment to help support them and get them on their way to recovery. So during the pandemic, we feel like, maybe there's lots of things to do all the time, maybe feeling like there's even more responsibilities, but fortunately there's some clever ways that we can bring mindfulness into our day-to-day life without having to meditate for an hour a day or something like that. So things that we could do, so we're all washing our hands more, so we can actually even use hand washing as a mindfulness exercise. So it sounds kind of dorky, but you can, just slow down and see how the water feels and just be with the experience of washing the hands, which we're doing anyways, and it can give us a moment to pause. The next one is something I always aspire to do, but I'm not very good at it, is during the workday, just taking a step back, maybe even stepping away from the desk for a minute and taking some slow breaths and just noticing how we're feeling. Body scans are always great. I think that's a really helpful way, especially if we're trying to wind down at night. It can really get us into our bodies, and there's lots of nice apps that have guided approaches for that. And then I think it was the Yale website that had this stop approach. So we stop, take a breath, observe our feelings, and then proceed. So just sort of trying to give ourselves a pause and check in before plowing forward. Taking mindful stretches, or even doing short little yoga breaks. So it doesn't even have to be, with a mat or anything, but just doing a couple different stretches to move the shoulders and shift around. And I think another one that's always helpful is to reflect on something we're grateful for, which some days can feel really challenging, and sometimes we have to go really, really small with it, but just to find something, even if it's simple, that you appreciate and have gratitude for, I feel like can help to ground us a little bit. So living through a pandemic, I think, is, I guess, first to acknowledge, that what we're living through is tragic and challenging and unprecedented. But I think at the same time, to say that moving through this, it's almost like these things about humanity and the strength of humanity, you can perhaps see that more easily than if we weren't living through such a big, serious situation, if that makes sense. So just thinking about maybe times in our own experience over the past year where we've seen strength in ourselves or others, seeing if anything comes to mind. And I've definitely seen examples of resiliency and people adapting. I mean, a large example at URI is just all of the faculty and students in 2 weeks going to online, everyone moving through that and just doing what they had to do, I think is a huge example of resiliency and, rising to that challenge. And then thinking about impermanence, right? So living through a pandemic, I know for me personally, being a middle-aged person, maybe I hadn't thought as much about sickness and death. And living through the pandemic, it was certainly something that felt like it was right in front of us. It was collectively us, or right in front of me possibly. So thinking about that and how actually precious the human life is and how precious each day is. So it's almost like, I don't know, there's sort of this big thing facing us, but it points us to different features of being a human. And then of course, seeing the whole globe going through this together, and knowing, it's everyone has a different path and experience, but we are actually connected to each other in lots and lots of different ways, and actually need each other to be resilient and strong. So and then I got curious when I made that last slide. I was thinking about looking at news stories about over the past year or so of examples of humanity's strength and resilience. And I kind of pulled all the different articles. We don't have to go through them one at a time, but things like that, this left picture is a younger generation in New York City visiting with an older adult so that, they have some socialization. Medical worker, pretty sure in New York City, I'm trying to remember from that story. And this is a chaplain actually caring for a medical provider. Food packages being distributed and shared to those who are food insecure. And then a couple of stories about essential workers. So people who, oftentimes probably had to go because it is their job, but at the same time, having the strength and bravery to do these types of jobs during such a challenging time. So those are my reflections on, I guess, mindfulness, humanity, and living through a pandemic. And this is just a couple of resources about, so there's the URI Mindful Group, Shambhala Online, Glow, which has meditation and yoga, Headspace, which you might have heard of, is more meditation. And then of course our local All That Matters yoga studio as well. So maybe before we practice, does anyone have any questions or anything they want to talk about? I think I probably mentioned a lot of themes, so maybe we could open it for a minute of dialogue before we do a little meditation together. Mm-hmm.
So this is maybe a bit of an aside, but I find myself at various points of challenge. Like the last week was particularly hard for no discernible reason, right? Things work. It was almost like there was space for it to be hard. You almost have space to breathe, and so the difficulty catches up with you, and you realize that it's there. Do you have suggestions for managing kind of that ebb and flow of difficulty, or maybe coping that doesn't necessarily correspond to the realities that you're in? Because I think that's one of the things I've noticed is I'm really good at pushing through, but once I hit a space to experience, then it all comes in, and it becomes very busy and hard to take a step back and reground. So, I know that that's not a very specific question, but I do think it is also, I see my students doing this too, where they basically, when they have the tunnel vision and the focus, they're able to be very successful. And when there's the space for everything to be processed, that it becomes very challenging. So I thought, like I said, it's a very broad, I guess, comment. But something I think that a lot of us might experience.
Yeah, I think from your question, I know what you're talking about, and I guess we never know exactly someone else's experience, but I think I get your question. So I think one thing that I found really helpful was if we're thinking about having, I guess in the context of meditation, is sometimes, really big things can come up, and then instead of feeling like we have to like get through processing the whole thing, we could feel it a little bit and then just like come back to the breath. So it's like kind of this like touch and go. So like touching in, I mean, maybe it's grief, overwhelm, like these really big feelings of doom, like these really big things, right? And then sort of touch it and then just come back to just like simple breathing, touch it and then come back, instead of feeling like we have to go like through the whole thing and resolve it or something like that. Does that make sense? Yeah. Yeah, and I think another thing that's helpful is to think about this idea of equanimity. So sort of going through the ups and downs without getting so seduced by them. And I think it happens to me. I go, either way, right? So there's like the elation and then there's the depression, right? So, but sort of finding that middle spot. Will still, I think the real practice is finding that middle spot while not becoming maybe withdrawn or something like that. Let's see, we have a couple of things coming in on the chat. So Taylor said, I have a daily recurring alarm in my phone with emojis that reminds me to be mindful and check in on possibility for the day. That's nice. Yep, it helps to interrupt getting lost in the scroll. Or as my friends and I have been calling it lately, we call it the doom scroll. So if you're in your news app or your Facebook and it's just doom, doom, doom. Yeah, that's a good idea to try to interrupt that. Mm-hmm.
Hi, Steve Atlas here from College of Business. I'm curious to know more about these environmental cues that we can be using to return to mindfulness. One is that daily recurring alarm that Taylor Booth just mentioned. I'm wondering what other, I have friends in other universities that have used things like every time they walk through a doorway, they use a doorway as a sort of a visual reminder to reconnect in some kind of way. I'm wondering what others have found to be useful environmental cues for that reminder.
That's a really good question. I guess for me, sometimes it could be as simple as like my breath, or like going back, actually feeling my body sitting on a chair or cushion, or even just like actually like feeling your presence in a room, which for me lately it's been the same couple of rooms, but actually feeling myself in my room, in my house, like in Wakefield, like actually having that felt sense of like, oh, there I am, if that makes sense. Does anyone have any other thing, especially maybe like out in the world? Yeah, Allison.
Yeah, so something that I found, especially in the past few months, that's been very helpful for me is just planting my feet like firmly on the ground and just being aware that my feet are on the ground, my body is here, I'm not in my head. And just listing the items around me, even just the most simple things like, oh, I have a comb nearby, or I have a book nearby, or XYZ thing, just listing that. It kind of just reminds me that there's a world outside my head and just kind of gives me that moment to just kind of ground.
That's really nice. I like that. Sort of coming back to what's happening now, like now. And I guess once we say now, it's already in the past, but you guys know what I mean, right? This moment.
Sorry for my freaky sunshine in my face, but I'm enjoying sitting in the sun. I know it's making my camera be weird. But I'm working primarily from home and have been for a year. And I'm used to being out and about, all day in a car or sitting in an office or visiting a lot of people. So I'm taking, as far as like sort of an environmental cue, I guess, is mindful lunches. So I refuse to eat in my workspace, and I might sit right where I am, where I can actually see the great outdoors and neighbors, and have a mindful, quiet, do nothing lunch where I'm paying attention to what I'm eating and I'm chewing and I'm not multitasking. And I found that that's really helpful for a reset.
Yeah, that's really great and really, really healthy for us to actually have the experience of eating. Good reminder. We have a question from Sarah about, she said, thank you for your presentation. Yeah, of course, Sarah. And she says, how has your Shambhala training influenced your practice? Yeah, that's like a huge question. I would say, honestly, I don't know, maybe this is oversimplifying it, but like connecting with Shambhala and having a community of people to be able to practice with kind of just made it click. So like before, I'd always like, I thought it would be really cool to have a daily meditation and yoga practice or something like that. And then having that community and sort of the way, the way the practice was presented just really made a lot of sense for me personally. And I think, not that, I think each of us actually probably has like some sort of mindfulness, meditation, spiritual home somewhere. We have to figure out what feels right. It's just kind of like you just sort of know, I guess. But yeah, I think the big thing there was having a group of other people who, were committed to mindfulness and wanted it to be part of their lives. So here at URI, having that URI Mindful Group is a chance for us. It's not Shambhala meditation. It's like sometimes we have some flavors of that. It's, mindfulness in general, but the main thing is having each other to look to for inspiration and just to practice together.
I just want to say thank you one more time for sharing this with us. I think it has been particularly relaxing, but also refreshing moment. So thank you.
Yeah, really my pleasure. I really appreciate the invitation to come speak with you guys. I was honestly a little bit nervous because it sort of blends my personal spiritual life with my work life, and it's kind of a space that I don't stand in as much. So I appreciate you guys listening and sharing with me as well. Thank you so much, everyone. Take care. Be well.